When you think of ketamine, you think of illegal drugs, you think of ecstasy, MDMA, Molly, things like that. But it has been approved and used as an anesthetic for a very long time in the United States. But there is a new treatment underway using ketamine as a way to treat those with difficult backgrounds, people dealing with PTSD or severe depression or other mental health conditions. And there is a facility here in our area in Franklin that is doing just that. It is called the Drake Center for Transformative Health, and Dr. Cassius Drake, a former ER doctor, is the founder and joins me to talk about the work that he is doing. Doctor, it's good to have you.
Hey, good afternoon. It's great to be here.
So tell me a little bit about your background and what led you to the Drake Center.
Yeah, thank you for introducing me. I was an ER doctor for about 20 years before I began this work. Led a successful ER for about 7 years, nationally recognized. And during the course of my career, I also did a deep dive into all the other various forms of healing, including emotional perspectives and spiritual perspectives, to try to be a more complete healer. As psychedelics have become more in vogue and in use to help some of these challenging situations, my wife and I decided to jump in and start using this very transformative and powerful new cutting-edge treatment to support people getting through things they haven't been able to get through.
So
opening doors to change.
Who would be the ideal candidate that you would see at the Drake Center for Transformative Healing?
Patients with treatment-resistant depression, anxiety, PTSD, people who have tried therapy, talk therapy, and still find themselves stuck. They may be very aware of their challenges, but they just can't seem to transcend them. And so the use of ketamine or other psychedelics with associated with guidance and coaching and integration can be powerfully transformative for people to help them open new doors, get unstuck and find themselves in a new place.
How important is the coaching side of this, kind of the therapeutic side of it? Because, there are places around the country that deal in the psychedelic treatment where they use these chemicals to then try to deal with like things that you're dealing with, PTSD, depression, things like that. But how does the element of the therapy side impact the treatment of your patients?
Yeah, so from our perspective, the therapy element is critical. The experience of having a psychedelic, be it ketamine or MDMA, which may be approved shortly, is powerful. It opens up new insights. It generates new neuronal connections and neurogenesis, and it can place somebody in a different place. Now, you still need coaching, though, and integration and how to keep that with you and how to make that a part of your life. So if you have a powerful experience of feeling transcended peace, for example, what do you do with it, right? And so we use, in our integration program, we help people to understand, how do you put that in your life? Once you've had a taste of a different place, how do you integrate that into your life so that when the afterglow of the actual ketamine treatment has faded after a week or two, that you're not right back where you were? And that's the risk of doing this without integration or coaching, is that the mood lift that happens can be temporary. And unless you do some work to really anchor those insights, it can slip through your fingers. And so in our process, we guide people into how to really anchor these things and to keep them with them long term. So then somebody walks in the doors, what's the process that they'll go through? Well, first we go through a detailed intake process. With an hour and a half, we'll sit down with them, get to know them, get their background, make sure this is right for them, make sure there's no contraindications, beginning to build a roadmap for their whole journey with us. They then come back for a preparation session, which is unique with us. And in preparation is where we take a deeper dive into the logistics and look at how to get the maximum benefit. What's the right door for this person in this experience that'll really support them. And then they come to our office in Franklin to have the actual treatment. We have a wonderful environment. The setting in which you do this is essential. And so we have a very serene and beautiful environment for people to have the experience. In our facility, no one ever does ketamine alone. My wife and partner are with every patient, and we have supervised personally almost 1,000 of these journeys over the last 3 years. After every treatment, the patient has an integration session with either myself or my partner. And integration, we take that deeper dive and we'll say, okay, this is what you got in that experience, or maybe you didn't get anything from the experience, and then that'll bring up something. And we talk about, all the emotions that come up and how you can combine that with that experience to get long-lasting change. Then they come back to have another treatment, and then we follow that up with an integration, and we add life coaching, and we'll do creative work, and we teach mindfulness and meditation techniques, so that once someone's had a powerful insight, we give them very practical tools that they can use in their daily life to keep that insight alive.
How many ketamine treatments would they have?
Our process is 6 treatments.
Okay.
Typically scheduled out over 8 to 10 weeks. Where we'll have a treatment. You spend about a week integrating the insights, come back again. And at the end of that 6 treatments, over that period of time, combined with the integration and time to have practice, patients find themselves in a very different place. They've developed, resiliency to life. So if someone's suffering from anxiety, sometimes they have anxiety about anxiety because they don't know how to stop it. And now they have a tool that they can use to center themselves. If it's PTSD, they find out that the thing that they're reacting to, that's not happening to them anymore in this moment. And they stop having those physical symptoms that can just be present. Is
there ever a concern for addiction here in people you've seen?
Yeah. Yep, and that's a legitimate concern. Ketamine can be addictive, which is why it's important that it's used in a guided process, in a way that's about taking the experience and using the integration process to keep the insight with you. So you're not reinforcing this idea that the only way someone can feel better is to be in a ketamine state. I mean, that's not our goal at all.
Sure.
Our goal is to use it to open this space so you can understand that you can feel differently.
Yeah.
And then we support you in realizing that you can have that space in your daily life, and we teach people how to do that in a practical way. So we use the experience, and then, this is how you can stay there so that it doesn't become something that you're dependent on. That's not our goal.
Interesting stuff. Dr. Cassius Drake, the founder of the Drake Center for Transformative Healing, using ketamine treatment to help those dealing with severe mental illnesses like PTSD, severe depression. Doc, thank you so much. Appreciate your time, and best of luck going forward.
All right. Thank you so much for having me on. Appreciate it.
Yep, you got it. In the meantime, we'll step aside, take a break, make way for Fox News, get you an update on the Donald Trump trial. The jurors are still deliberating, and if they come out, we will certainly bring that to you right here on WJ.